Uju got married, and after 5 years of waiting, she got pregnant. You can imagine the joy when she found those 2 lines on the pregnancy strip. During the first trimester, she noticed some complication, and then unfortunately, she lost the pregnancy. Imagine how her world crumbled. Today, we'll be talking about miscarriage and how it affects the woman on Health Unplugged, brought to you by Lifeway Medical Diagnostic Hub. Here we discuss and dissect important health-related issues that matters to everyone. My name is Amazing Rita, and I have Dr. Dimba Favor with me in the studio.
Hi guys.
So we'll be talking about miscarriage. Dr. Favor, what is miscarriage?
Okay, miscarriage is the loss of a fetus before the age of viability. Some people say before 20 weeks, but age of viability is the age where you say this thing has life in it. Do you understand? And for different countries, they have different gestational age they use as age of viability. Yes, but generally, some people just use 20 weeks as age of viability. So the loss of a fetus is that thing, the baby that is still forming. The loss of the baby before the age of 20 weeks or before the age of viability. Okay, like in Nigeria now, what we consider as age of viability is different from what they consider as age of viability in the UK, and it's equally different from what they consider as age of viability in the States. So, but generally, we can use 20 weeks, the loss of a fetus before the age of 20 weeks gestation is considered as miscarriage. So, miscarriage is also the same thing as abortion, but then it's the medical term. The medical term for miscarriage is abortion.
I used to think abortion is when you decide to remove the fetus. Then miscarriage is that it happened all of you miscarried the fetus.
Okay, no, they're the same thing, but one is a medical term for the other. Yeah.
Okay. What causes miscarriage?
Okay, there are different things that can cause miscarriage, like God being so kind. Imagine someone giving birth to a baby and then the ear is located here and the eyes is located here.
My God.
Ahead. So the first important reason why miscarriage could occur is chromosomal abnormality. Yes. Like God just made it in a way where this baby is not going to come out well. There are some abnormalities in this child. So naturally that person will miscarry that child. That child will spontaneously go away. Yes, some other things include infections. Yes, I had this patient who came, but by the time she presented to the facility, she had already miscarried the babies. But then when I was trying to get a history from her, she said at early hours of that morning, she presented at about 10 a.m., 11 a.m. At 4 a.m., she had very high fever. But that was not the first time she was experiencing that high fever. Some couple of days before that, she had the same episode of high fever and she did nothing about it. So that was like a warning already that something was about to happen. And then 4 a.m. that day, she had the same high fever and did nothing about it. By 10, the fetus had already passed out. Other reasons, we have like a situation where the woman's cervix, there are some uterine anomalies. Yes, like insufficiency, cervical insufficiency. This person will be experiencing miscarriages. Other things like exposure to radiation, some drugs, some maternal factors. Maternal factors, I mean some factors coming from the mother, someone that is chronic diabetic, they have some underlying issues. Yes, they are at risk of having miscarriage.
Okay, can miscarriage happen at any point of the pregnancy? Like 8 months, 3 months, 5 months? Can it happen at any point?
Okay, miscarriage can happen, but like I told you, we consider it miscarriage or abortion when it occurs before the age of viability.
Okay.
Yes, like I told you, we can use 20 weeks. Yes, but the UK now, their age of viability is 22 weeks.
Okay.
Yes, I think the States, they use either 20 or 24. Yes, so any loss of the baby that occurs before this age of viability is what you consider as miscarriage. You don't consider it as a miscarriage or abortion anymore.
Okay.
So it must be the loss of fetus occurring before the age of viability. Yes.
Okay, so how common is miscarriage?
Okay, I won't really say it's so common. From the last I read, the last research carried out, they said about 3% of women undergo miscarriage. Yes, in pregnancy. So I won't really call that a common occurrence.
Okay.
Yeah.
But this is going to be a very funny question. What is every woman that is pregnant, is she at the risk of miscarriage? Every pregnant woman.
This is a dicey one. But to the best of my knowledge, I don't think every woman is at risk of undergoing miscarriage. Yes, like I told you, based from those risk factors I listed out earlier. Yes, if you don't have any of these risk factors, if you're not exposing yourself to radiation, if you're not exposing yourself to drugs, it's highly unlikely for you to undergo a miscarriage, except if it's a spontaneous abortion.
What are some of the signs and symptoms of miscarriage?
Okay, like in that index story I gave you, that index patient, yes, she had high fever. That could be secondary to an ongoing infection.
Okay.
Yes, some infections like urinary tract infection, the person will start having symptoms like fever, painful urination, lower abdominal pain, or chorioamnionitis. Chorioamnionitis is when the amniotic fluid, that thing people do call my water has broken, when it gets infected. So these things there are already infections that could lead this woman to having an abortion. So they come with high fever, maybe pain. Then other things you could see, spotting. Yes, you could see spotting in the case of a threatened miscarriage. This threatened miscarriage is not like the baby is still there, the cervix is still closed, but the person could have spotting. Yes, it's just showing you that more precaution needs to be taken. If not, this baby
can you break down that spotting for us?
Okay, spotting is just like it's not like drops of blood. Spotting, yes, that's what spotting means. But sometimes it could come with normal pregnancy. Do you understand?
Okay.
Yes. So it's just important when you spot in pregnancy, it's good you take it to your healthcare provider so they would be sure you're not tilting towards a threatened miscarriage. Yes. So there could be passage of clots or tissues. This one is in a case where the miscarriage has already occurred. Yes, there could be back pain or waist pain. There could be fatigue. This one will occur in a case where the woman is already bleeding, and then because she has lost so much blood, she'll start getting weak, being fatigued, very tired. So these are some symptoms you could see.
How is miscarriage diagnosed?
Okay, like I said, with these symptoms I mentioned earlier, yes, you could see a woman coming to your facility and she's telling you, I had spotting this morning or some days ago, or I'm having lower abdominal pain, or I passed clots, I passed some tissue-like substance, or I'm having low back pain, or even what I explained earlier, the high-grade fever that comes with some infection. Yes, but then to actually confirm that this woman has had a miscarriage, there are some you will just see on the spot and you know, because the person could have passed out the fetus. So like the patient I told you earlier that presented to our facility, she had twin gestation, but you could see the two fetus. So that one is already obvious that this is miscarriage. But then in some cases like incomplete, threatened, you could still further send her to do a scan to be sure that the fetus is still there and intact.
Look, you just said something like incomplete. Are there different types of miscarriage?
Yes, there are different types of miscarriages, but then you can further group them into early and late.
Okay.
Yes, like I told you, the loss of the fetus before the age of
20
viability. Yes. So, but I told you we could use 20 weeks as a cutoff or an average. So the one occurring in the first trimester, the first 13 weeks, that one is early miscarriage.
Okay.
Then from 13 weeks to the 20th week, that one is late.
Late.
We also have induced and spontaneous. Induced means like this one, they're is actually the healthcare provider that is telling this person you need to do this for your safety.
Okay.
While spontaneous is occurring on its own. So under induced, we have some types. We have the legal, we have therapeutic. This one is like you need her to do this thing for her to be well. Yes, that's where therapeutic comes in. Then you have illegal. So these three, they are under induced. While under spontaneous, we have the threatened miscarriage, the one I explained to you earlier, that this person is having spotting, but then the cervix is still closed, the baby is still viable. So that one, you just have to counsel her on precautions to take for the pregnancy to continue. We have complete miscarriage. Now, in this case, the cervix is already open. You can see the patient has already passed out the products of conception. You have incomplete. This is a situation where it's just some of the products are still retained. Yes. So for that one, you need to do a surgical or a medical approach to remove what is left there. We have septic abortion. That one is a case where maybe something like an infection caused it. Yes, this person was having high-grade fever, maybe a urinary tract infection, chorioamnionitis, and nothing was done about it. So septic abortion. So these are some types of miscarriage or abortions we have.
It can, at least some types of miscarriage that can be prevented.
Yes, like the threatened I just talked about. I said the cervix is still closed. The baby is, the fetus is still viable, but she's having some signs. Like if further care or precaution is not taken, you may lose this child. Yes, so they could prevent it from happening. They will give their medications to use to help prevent it from happening. But then, like I said, spotting could come with normal pregnancy.
Yes.
So it's always advised, once a woman notices that she's pregnant and she's having spotting, it's good she sees her healthcare provider so they are able to detect on time if this is what comes with normal pregnancy or if it's coming as a result of a threatened miscarriage.
Okay, so having one miscarriage, does it mean that the woman might have a miscarriage going on, or there's likely a possibility of her having another one?
Okay, I think we'll classify that more as, or we could better say, this woman would likely. But that does not mean she must. Do you understand? Yes, there's a difference. Like this person has had a first miscarriage. It does not really mean that she must have another miscarriage. But then, for the fact she has had the first miscarriage, it's likely she could have another miscarriage. Like I told you earlier, some uterine or cervical abnormalities. Like now, somebody having cervical insufficiency, that person is at risk of having miscarriages. Yes, and then there's something called 2 or 3 when someone keeps having consecutive miscarriages. Yes, so there's an event like that where this person has miscarried this child, next pregnancy she's miscarrying again, next pregnancy she's miscarrying again. It happens like that. Yes, but then having one miscarriage does not mean you must have another miscarriage, but then it's a risk factor for subsequent miscarriages. Yeah.
Okay. There are some women that suffer stress, emotional abuse in marriage, stress from job, stress from family.
Yes.
And probably the home is not so, how would I put, comfortable for her. You know, with this kind of lifestyle,
Yes.
Would it put the woman at risk of
Having a miscarriage. Okay, to an extent, yes. The reason is this: from the angle of stress. Stress could cause hormonal imbalance. And then there are hormones that are responsible for pregnancy, like progesterone. So in a case where the woman is extremely stressed and then the hormonal imbalance is occurring, like it could alter the hormones from that's the link to which this person could have a miscarriage.
Okay.
Yes. So majorly hormonal imbalance could come as a result of stress, thereby altering the pregnancy and causing a miscarriage.
What of medical factors that can increase risk of miscarriage?
Some cases like, okay, now a situation where the mother has some chronic illnesses, like now hyperthyroidism, where the thyroid gland is producing excess hormones, and thyroid hormone is responsible for the metabolism of the body. Yeah, so the medication in that case, if the hormone level is so high, such a patient, they may medically advise her to terminate that pregnancy because the medication that will be used to treat her is teratogenic. Teratogenic in the sense that it's harmful to that developing fetus. The baby may come out now and is having the eyes at the back or something like that. Yes, then a chronic diabetic, you get to an extent where the blood glucose cannot be controlled properly. Yes, so it will be advised that pregnancy is terminated. Then there are some other conditions where they will do a karyotyping, that's checking the baby in utero, and then they're seeing their chromosomal abnormalities in this child. Medically, to be advised that pregnancy should be terminated. Yeah.
What about food? Are there certain food the woman can eat that can cause miscarriage?
For foods, there is no one that is really actually proven.
Okay.
But then there are some that are still under research. Like there are some types of fish they said should not be consumed, especially in first trimester. Then a lot of milk should not be consumed, especially in the first trimester, because it hampers the absorption of iron. And iron is very important. Yes, but you won't call alcohol a food, but for some women, there's some people who are already
chronic alcoholic.
Exactly. So alcohol can tilt a woman very much to having a miscarriage.
All right. So that is a myth, but they will say miscarriage occurs because the woman has done something wrong. Some of them will say probably the woman had an affair outside, or the woman. I'm talking about the cultural, religious part of the myth. The woman had an affair outside, or the woman has some spiritual attachment somewhere. But is there something? Can miscarriage happen because of something the woman did wrong?
I won't have the perfect answer to that. But I'll just give my opinion from medical terms.
Okay.
Yes.
So
from medical perspective.
Why don't you put on your pastoral mantle and give us the religious part? Okay, from a medical perspective.
Okay, from a medical perspective, I would always say that there will be a reason for that miscarriage. I don't think it should be as a result of her maybe doing something wrong in the past, and then that's why she's having this miscarriage. Even if we're to bring in the religious aspect of it, I don't think God is a wicked God. God is a God of mercy and compassion. So I don't think he will want to punish this person because she offended him. We all offend God at one point or the other in our lives. So I don't think God is like that he wants to take away the life of the child or allow her undergo the pain of miscarriage just because he wants to punish her for a wrong act.
See, your pastoral mantle just came up.
You can call me Pastor Favor.
Okay. All right. You also talked about some genetical issues the woman might be having in her family. So what are some of those genetic disorder or genetic diseases or we should look out for, or should I say people should look out for in their family that can likely put them at the risk of miscarriage? You talked about thyroid.
Yeah,
Is that genetic?
To an extent, it could have genetic
Okay.
factor.
Okay.
Diabetes.
Okay.
Yes, they could have genetic linking. But then other aspects, like now, I earlier said this baby could have a chromosomal abnormality where instead of the child having the normal 23 pairs of chromosomes, the child is having either an additional pair or incomplete pair. Yes, for that one you can't see it physically, so they will need to do a karyotyping to detect it. And then for that child, maybe nature may just help the woman take away that child. Yes.
Talking about genetics,
Okay.
is it, if your mom suffered from miscarriage, are there possibilities that the woman, like you yourself, would suffer from it?
I won't really say.
Okay.
Yes, because it's not, there's no proven fact on this yet. So I won't really say because this person's mom had a miscarriage. Yes, then the child must have a miscarriage. I don't think it works that way.
How long would a couple have to stay, or a woman have to stay before trying to get pregnant again after a miscarriage?
Okay, I don't think there's a fixed duration attached to this because it also involves individual differences.
Okay.
Yes, a woman who has had a miscarriage would have to heal in all areas. She'll have to heal all round before thinking of conceiving again. When I say all round, she'll have to heal both physically because she has lost blood, she has lost strength. There could be one or two issues she has undergone. So she'll have to heal completely before thinking of taking in again. She'll also have to heal emotionally. So like I said, it also depends on individual differences. This person may take a space of 3 months and then she's whole completely. This person could take 6 months. The person who has also lost blood, would have to replenish. So it also depends on financial capabilities.
Okay.
This person may be able to feed healthy and then it will help her healing process. It will aid it to be faster. Meanwhile, this person may not have the financial ability to take everything she requires to heal completely.
Okay.
So you discover it will take her longer time to heal as compared to this person who is financially capable.
Okay.
Yeah.
One of the most important questions I have for you today: how does miscarriage affect the mental health of women?
Okay, I think to a large extent it does very well because first of all, imagine a woman who maybe she has not had a child, like the instance you gave, the story you used to introduce us into this session. 5 years of waiting, and afterwards she was able to take in. After taking in, she's now told that she has a miscarriage. First of all, she'll feel like a failure. Like within her, she'll be telling herself, I failed again. Then it could be that it could come with some form of stigma.
Yeah.
Possibly, maybe people around her would talk about it, stigmatize her. She'll feel really depressed because it's not easy. Like you're having an expectation, okay, let me make up my mind to do this for 9 months, and then before you could even get to 5 months, you've lost the child. Yes, she could go into a state of depression.
Yeah.
So you could see it really takes a toll on their mental health. It's not so easy to have a miscarriage. Yeah.
Okay, so how can we help? How can they cope? What can we do to help women who have undergone or experience miscarriage?
Okay.
How can we actually help them bounce back? How can we help them heal? Not just physical healing now, but their mind,
mentally.
and everything.
Okay, first of all, I think they will really need the support and encouragement of their spouse. Spouse, you cannot overemphasize the importance of that. Yes, the role of the spouse would go a long way in helping them get back on their feet. Then as the doctor or the healthcare provider, you're counseling. Yes, when you counsel, you also have to do that with empathy, putting yourself in the state of this woman. And that way you get to understand what she's really going through. Even if you may not get the feeling to the full extent, but to an extent, when you have that empathy, it helps you counsel her in a better way. Yes, then she could also, there are groups that are organized for people who have had miscarriage in the past, to help maybe build their mental health back, emotionally build them back. The woman could enroll or join such groups to help her build back her self-esteem and what have you.
So you mean, lastly, before we go, you mean it is safe to try again after miscarriage?
Yes. There's no rule that says after a miscarriage you shouldn't try again. There's nothing like that.
And there's no particular time frame. It just depends on the individual
differences, yes. But despite the fact that there's no particular time frame, the woman must have healed. Emphasis on she must have healed, especially physically. Yes, because if she has not healed physically, she's not properly healed physically, it could even tilt her again. Imagine a woman who is still anemic, possibly she lost so much blood during the last episode, and then she's still anemic, and then she goes to take in again. Yes, she would have some issues going on with that pregnancy. So emphasis on the word proper healing. The woman must heal properly before she tries again.
And of course, to add to that, with proper healing, fear goes off. There's a way I always say our mind works with our body. When there's fear in the heart, even if it's just normal spotting, like you said, that occurs with pregnancy, you start thinking, "Oh, have I lost this child again? Is it happening again?" Okay. So thank you so much.
And then she should ensure she's regular with her antenatal visits. Yes, because not registering for antenatal visits is already is one of the risk factors for miscarriage, because someone who has no one in charge, monitoring her pregnancy, no healthcare provider to monitor, she has no healthcare provider to tell, this is what I experienced in the some days ago, that person is also at risk of having a miscarriage. Just like the patient I gave you an instance of, she in some months before that, she had high temperature, fever spikes, and she didn't tell it to anyone. She only felt it was important to see a healthcare provider when the fetus had passed out. Yes, so they will also need to enroll for antenatal care. That's very important. And then be compliant with their routine medications.
Thank you.
You're welcome.
Thank you so much, Dr. Favor. Yes. So you've heard it. Miscarriage is not something that happens and it must happen over and over again. It's something that can be prevented. And if your healthcare provider advises you to terminate or evacuate a fetus, it's not because they hate you.
Not at all.
Most times, in fact, most times it's because it's threatening your life. And of course, what is a baby without the mother? As much as we want the baby alive and healthy, we also want the mother alive and healthy.
Very important.
Very important.
Because if the mother is alive, even if she lost that pregnancy, she could still take in again and have other babies.
You can always take in again and have other babies. Thank you so much, Dr. Favor, for that very educative information that you just shared with us. And in case you want to learn more about important health topics that matters to everyone, do subscribe to our channel. This is Health Unplugged. My name is Amazing Rita.
And I'm Dr. Dimba Favor.
And until we see you again in our next episode, it's bye for now.
Bye.